Hi guys, it's Dr. Selene with BU Medical. I want to talk to you about one of the things that I discovered years ago that I really like, and it has a special niche for different problem areas. What we're going to talk about today is Kybella. Let me tell you about my personal journey with Kybella. So when it first came out years ago, I was super excited. I was like, this is everything that I've ever dreamed of, which is killing my fat without doing anything other than an injectable. I was like, this is a dream come true. And I had little areas of fat that I've always had my entire life, mostly in the submental area, which is where Kybella is indicated for. My little guy, who's only 5 years old, I can see that I gave him the same thing. So it's nothing about being fat. It's nothing about, being overweight or eating habits. It literally is genetic for some people. And for me, it was. So the way I knew that it was genetic in a problem area for me was that even if I weighed 90 pounds or 150 pounds, it stayed there. And being Hispanic, I kind of don't have the most robust chin to begin with, so having a weak chin and a little submental fat was a double whammy for me. So my profile was limited in that I didn't have any projection and I also had fullness under the chin. Jawline is a really big thing right now that you'll see going around on Instagram, these super sharp jawlines. But one of the things that people don't address, and one of the things that you'll see, is that people put filler in the jawline, adding some volume to that area, but we actually need to take away some of the volume that's in the areas that we don't want first. So an educated approach to this is much better. So what I always say is kill the fat that's around there, and then we can sculpt, and then we can go in and kind of act like a sculptor of a big project and then sculpt you out. But don't add volume here and still be volume in the lower face and under neck area. It makes no sense. So for me, my problem was that I was exercising, I was doing everything that I could. I remember back in the day I would do these weird jawline exercises that I learned from my Japanese exchange students, like do this and try to tighten that up. Nothing worked. It's just submental fat that was going to be there. Again, no matter what I did. The other areas that I started to dabble into were like little bra fat areas where no matter how many arm curls I did or how skinny I was, I still had a little bra line fat. And so what I always say with Kybella is it's a great option for areas that you can pinch. And if you can grab it, so if it's a grab, it's a great cool sculpting area. So my general rule is if I can pinch it or pinch it, then it's a great Kybella area. If I can grab it, which is more belly and back fat, then I might go with cool sculpting. My learning curve for Kybella was a little bit steep because I did get that bullfrog look, I got the chipmunk look, but as I learned kind of how to inject it, it became easier for me as the client doing it to myself and knowing how to distribute it to other people. So what Kybella is, it is a acid that we normally kind of form in our own bodies that kills fat, but it's a concentrated acid that we can drop in a needle. In our clinic, we do add lidocaine in it so it can kill some of that acidic feel because you can feel it being very acidic and burny and stingy. And then there's a grid-like thing that you'll see on Instagram. It's very classic. It's just dots that are separated by a certain distance. Some people may not put the grid on you. We don't anymore. We used to, but we do so much of it that we know exactly what the grid-like would look in any particular area. So if somebody doesn't put the grid, it's because they probably do it enough that they know exactly where to go. The one thing to know about this, it does need to get into the fat area in order for it to work. I treated this Instagram famous girl one time and she was like, it hurt like crazy and no results. Well, it had gone into her muscle. So if you go into the muscle, not only is there not fat in that area, it's not really treating the area and it will ache. Nonetheless, it does hurt a little bit. So just be aware that the needle pokes, we often don't even need to numb for this. You can ice beforehand. We go ahead and put multiple injections in the area of concern. It's on label for the submental area, but we actually will do some fine tuning around the mouth. And kind of treat the whole area. We typically recommend at least 2 bottles or 2 vials of Kybella. It's done in a series. Remember, this is also not a one and done. I always say expect 2 to 5 treatments. If you look at the studies, and we'll show some pictures here, that you can see over time, these study patients did a lot of vials multiple times. And so it works, it's beautiful. It's not a question of whether it will work or not. It's a matter of dosing and you continuing your treatment. At a certain point, you're just left with some skin, which normally retracts, and the studies show that it doesn't cause you to be all loosey-goosey for the most part, but it does take away the fat. So if, let's say, you were super full here and you've eliminated the fat, you might have a little bit more laxity of the skin. There are other modalities that we have that can lift that up and treat that area, but just be aware that if there's no fat there, there's no longer something under the skin holding that taut. I love it. It's a minimal downtime procedure. You do get swollen. You'll see on YouTube, some people are like, that was the worst thing I ever did. It was super swollen. I look like a frog. And yes, that's true. With the lidocaine, it can diminish that. So it's true, but we have modalities that can help it not be so painful. So when we inject the medication, we put multiple areas, multiple spots. So hopefully there will be some swelling, which we want. Remember, we want your body to be eliminating this fat, but hopefully the swelling won't be so much that it impedes on your life. You will definitely notice that you're swollen. The loved ones around you, they're used to seeing that little chin fat, and they're used to seeing you a little full on the sides. What I do is right now in mask world, I just cover up. So I say it's a beautiful time to do Kybella and get rid of any little areas, pockets of fat that you may have. And before bikini season, also great time to do arms and little pocket areas as well. I've even had some skinny girls do even little things around the belly where they have pockets of fat. It's a minimal downtime. The downtime is really from bruising and swelling, and that can last up to a week to 2 weeks. The only other thing that I mentioned to some people is there's a little nerve that comes through here that sometimes can get affected, and if it swells up, it can cause a little bit of a change to a smile that's not typically permanent. It never has been for our clinic, where the nerve just gets agitated and then your smile looks a little funky and then comes back to normal. So there are some risks involved, and like I said, pain, swelling, bruising, all the normal things that you would think of when there's a needle going into your face, but it's a beautiful modality. If you're curious about it or you have areas of concern, we can walk you through what is your best option. Is it Kybella? Is it cool sculpting? Is it more tightening? And it really does have to be fat in order for Kybella to work, because that's what it targets and that's what it does. I hope that helps you guys take care of the areas that are insecurities for you. This was a big source of insecurity for me. It truly is one of the best things I did. It's a permanent solution and it's a beautiful solution. And if you put the investment in, it's a great result. Remember, we want you guys to look great so you can feel great, so you can do great things in life. Take care. Bye.